Assalamu alaikum everyone. I'm Dr. SAMI once again from the platform of PNMDP, bringing you a very important topic of communication skills. This is the first part of my presentation because it's a huge topic. I have divided it into several parts and I'll be discussing each part separately. So I have relied mostly on my resource from Royal Australian College of Physicians RACP Communication Skills Workshop. So if you could consider communication skills as a toolbox that a physician has, that a physician carries around. So within this toolbox there are 4 compartments, and within each compartment there are different components. So I'll be discussing the first compartment of this toolbox, which is the key communication skills. Within this compartment, there are 3 major components. The first one is active listening. Yes, it is very important for a physician to listen first and not to start the conversation with just all the investigations and management and everything, but rather just to listen to the parents, to the guardians. So active listening is very important. The second is a non-verbal communication, the body language, the non-verbal cues that you are giving to the parents, to the guardians, or that you are receiving from the parents during your consult about a patient. So I'm talking about communication skills with respect to a pediatrician, because that's what most of the people are on this platform. And the third major component is the language to use, the kind of language to use during your consult. So with regards to active listening, this is a very important component of communication, because actual words actually impact on your conversation at around 5%, but it is the non-verbal communication and your body language that impacts around 60%. So that makes up the actual impact of the conversation, and 35% of the influence on effect is produced by the individual's tone of voice or intonation. So at times we do say that we wonder that we haven't been rude or we haven't said anything inappropriate, but why, or we have actually conveyed everything in our conversation with our patient, but still the patient seems to lack confidence in us and is not compliant to our management. That is due to the fact that the language that you displayed during your consults was not confident enough. Either you were rushed, or you were disinterested, or you gave some of those cues while you were doing your consult that were taken up by the patient or the parents or guardians in a manner which felt inappropriate to them. So it's very important, in short, to keep your body language and appropriate, and your intonation, your tone of your voice should be appropriate as well. It shouldn't be judgmental, it shouldn't be harsh, and because patients are really very quick in picking up the cues that physician is giving to them. If the physician is not listening, or he's fidgeting, he's not confident, he has no concentration in a consult. So all of these things are picked up really quickly by the patient or by the parents or guardians. Also, active listening doesn't really mean that you have to paraphrase a patient's words. If I give you an example, for instance, a woman comes to you with her son and she's really distressed because her son is complaining of pain in the stomach. So if she's telling you that my son has pain in the stomach, you should reply, considering the whole situation, the scenario, you should reply in a manner which is empathetic and caring, as well as um, does involve the question too. Like, I understand that you are distressed. I understand that you are worried about your son, and uh, that seems to be the case. But could you please calm down for the sake of your son so that I could examine your son properly? So that's how you would allay her anxiety and make her calm enough so that even you can act in that moment. So all of that is part of your emergency care as well if you are dealing with patients in emergency. Going beyond that, it's very important to accept the thoughts, values, and emotional state of the patient or the parent or the guardian. So I take it in this way that, for instance, a lot of times when we are dealing with a malnourished child, so we tend to become judgmental. We tend to kind of through our language, we tend to convey that the parents were doing wrong practices and that has resulted in the child becoming malnourished. So instead of taking that path, it's very important. For instance, if a mother is giving goat's milk to her infant, so instead of getting all judgmental, then why are you giving goat's milk and didn't you know and all that, you can use it. You can use you can convey your message in the following way: that okay, I understand that in your culture or in your area, in your setup, people do give goat's milk to their infant, but in actual, medically and scientifically, goat's milk has been found to be poor source of nutrition to infant, and that could result in anemia, that could result in different nutritional deficiencies. So in the start of the consult, you actually accepted that okay, this practice that you were doing, that was part of your what was normal for you, and I accept that, and I'm not being judgmental about it. But at the same time, you carried out your thought and your statement as well. You followed it up with your statement as well. So it's very important to be accepting of the patient's thoughts, values, cultural, traditional norms. So how do I use active listening in my communication with patients? So how do I tell my patients that yes, I am actively involved in the conversation? There are certain tips through which you can do that. The first and foremost is eye contact. Yes, eye contact is very important, especially at the start of an interview or consult. For instance, you are sitting in an emergency setting, so you have a computer system in front of you, and a mother walks in with her child, and she sits beside you, and she starts telling you what has happened, and all during this time you are just clicking away and typing the history on your computer, and you're not looking at her. You haven't positioned yourself towards her. Your body is not facing, your face is not facing towards her. You're making no eye contact. So just imagine what kind of impact that conversation or consult would have. So even if later on you try to counsel her about dietary practices, for instance, or hygienic practices, for instance, she wouldn't be listening to you. Why? Because you didn't start the conversation in an appropriate manner. You didn't build the confidence at the very start of the consult. You didn't make any eye contact. So it's very important that at the beginning you establish that relationship, and but be mindful of the fact that in certain cultures, very strong eye contact is avoided. It's not considered good, it's considered rude. So again, mold yourself according to the situation or according to the scenario. Also, in general, ask open-ended questions. Only ask closed questions where the exact information needed will change the situation, plan, or diagnosis. For instance, if it's a case of non accidental injury, if it's a case of child abuse, then the specifics of the condition and situation is very important. When, where, how, who. These questions are very important in a case of child abuse. So, in those cases, yes, you can ask close ended questions because you need to be specific. You need those specific details. Nod your head at appropriate times to indicate that you are attentive to what the patient is saying. Lean forward to indicate to the patient that you are open to conversation. Don't slouch on your couch or your chair. This will give a very disinterested posture and very disinterested appearance to the patient. Use pauses to allow the patient to communicate their thoughts and focus on the patient's verbal and non-verbal cues. So, non-verbal cues include all of these, but it's not only limited to these. But I would be discussing them because they are very important ones. Like, for instance, eye contact. So, at the beginning of a consultation or interview, it is important to greet the patient and make eye contact before referring to notes or a computer screen. And when discussing serious news, try to maintain eye contact, and this should be combined with other gestures like head nods and using words like, I understand, I completely understand what you've been going through. So try to use these short phrases in order to get that feeling that yes, you are there with them in the conversation. But remember, in some cultures, very strong eye contact is considered rude. So try to uh, judge the condition yourself. That try to mold yourself according to the situation, according to the circumstances, and keeping the cultural sensitivities in mind as well. Touch, if you're not a very touchy person yourself, it's better to avoid touch because it might get uncomfortable. But a simple handshake at the beginning of a conversation is good enough. Sometimes the situation can become too charged, like emotionally charged in the form of like you're breaking a bad news and the mother starts crying. So if such a situation arises and it's a very highly charged emotional atmosphere, you can give a simple pat on the back of the shoulder or a simple pat on the hand, and that could be a good gesture as well that you are there with them. And proximity, how close should you stand to the patient or to the parents or the guardians? Obviously, not too close because it might get awkward, but not too far away because in that way they might miss on your words, they might not understand you completely. So, a sensible proximity is important, but try not to hover over your patient. Like if your patient is lying down on a bed, it's better to take a seat beside him and talk to him at eye level rather than hovering over him. Gestures are very important. Head nods, smiles, facial expressions, they all convey emotions. So, giving gestures during conversation also boosts up confidence. And last but not the least, silence. So, at times, again, in emotionally charged atmosphere, like there's an you have broken a bad news. In those situations, silence can act as healing method, can foster healing, and can convey empathy. It can allow the patient to think, to invite the patient to join the conversation. So, a carefully placed silence in your conversation is as much important as words themselves. But be sure not to prolong silence too much because that might uh, become awkward. So, all of these postures should be avoided, like slouching on a couch or a chair with arms folded, as in the first picture. this shows that you are highly disinterested in the conversation and you're not open to a dialogue. You have closed yourself with your arms closed, your legs flexed. Uh, this gives a very uncomfortable um, sense to the patient and to the parents. So, and the second picture, which shows how a person is completely focused on their laptop and clicking away, this kind of posture should be avoided as well, because um, this shows to the parents or the guardians of the patient that you are simply not focusing on them, you're not interacting with them. So this should be avoided as well. And the third picture showing a person looking at the clock, checking your watch for time, or looking here and there, getting distracted, not focusing on the patient. Uh, all of these are very bad communicating postures that actually show that the doctor is not interested in meaningful conversation, and these should be avoided. So once we are done with active listening and focusing on nonverbal cues, the third component in communication skills compartment is the use of appropriate language. Now, appropriate language is that which is tailored to the health literacy level of an individual person. So, in order to use appropriate language, you need to know the health literacy of your patient. So, what is the health literacy? It is the overall general idea that the patient has about their health condition. Uh, Health literacy involves how much the patient has Googled himself, or if the patient is a doctor himself, or in our perspective, if the parents or guardians of our patient, they are doctors themselves. So they might know some amount of things about the disease. They might actually know quite a lot about the disease. So that constitutes the health literacy. And a physician needs to convey and consult according to the health literacy of their patient. So if someone who has already got some background knowledge in the form of the fact that, for instance, they are doctors and they have Googled a lot of complex ideas and terms by themselves, so they're already having a high health literacy level with regards to their disease. So for such a patient, a doctor might talk in the same level, might use some medical terms, might talk in the same level as that of the patient's health literacy. So if the physician is using overly simple language in such a scenario where the patient himself has a good health literacy level, so in that case, the patient might think that my physician is withholding some information. He's not being clear to me. He's using overly simple language. He might be withholding some information from me, and they might lose confidence in you because you are using overly simple language. So try to balance your act and try to convey according to the health literacy of the person you are consulting. Now, let's take an example. You are consulting someone who has come from village and he has never heard of the disease. He doesn't know what Google is and he hasn't researched anything. In those cases, you would definitely completely use layman language or the simple broken up language where the words are broken down into more simpler um, uh, phrases, and you need to convey that person on a very um, simple terms. So this health literacy is a very important concept that one needs to know. So if your patient or the guardian or parents of a patient, their nurse or doctor, they might have a certain degree of health literacy themselves, and you need to consult at that level. If someone is coming from far off area, they might have a different health literacy level. Also, whatever the health literacy level of your patient is, always remember to check back what they have heard, what they have registered, and how much they recall. So it's almost always very important to ask, what have you understood by all of this conversation? Whatever we have discussed, how much have you understood? What have you understood? Would you like to relay that back to me? Would you like to tell me how much you have understood what we have discussed? And if you have any questions, so that last bit of, inquiring how much the person has grasped, that is very important to effectively communicate. So, to sum it up, use of appropriate language means using non-medical language as much as possible, using living room language, which you can say it's a layman language. Try explaining medical terms by breaking them down based on their words root. That means, for instance, the patient has cardiomyopathy. So try breaking the word down into cardio is related to heart, myopathy is disease. So the patient is suffering from a disease that affects heart, and that's the reason why heart is not functioning well. So try to break down complex terms into simple phrases. Also, there are some other strategies that can be utilized. For instance, just as I discussed earlier, consider the patient's level of health literacy and the types of language they are using. Maybe they are using medical terms because they are doctors themselves. So consider health literacy. Use words that are very clear. For instance, if the patient is dying, you have to use the word dying. You can't use the word deteriorating. Deteriorating is something else. Yes, he's worsening, but what about the fact that he's dying? So be very clear what you need to convey. Take care about the positive and negative, the word itself. For instance, you may be telling a patient that your biopsy result has come out to be positive, and the patient might think, oh, positive is a good thing, right? So I'm fine, I'm healthy. But what did you mean? You meant that the biopsy report positive means you have the disease. So, but the patient got the wrong idea. So be aware of positive and negative, the terms themselves. Ascertain the level of information the patient wants to know. Not everyone wants to know the whole of the information at that moment. Maybe they want some time to absorb the magnitude of information. So maybe you can arrange a couple of more meetings. So you have to ascertain how much the patient wants to know at the moment. Explain anatomical terms, explain medical terminology, use simple English to assist patient understanding. Use visual aids where appropriate, and always explain a bit of normal anatomy and physiology. It's very important that the normal functions of the body, or whatever the organ, the disease organ is, the normal functions of that organ be known to the patient so that he or she might be more able to comprehend about his or her signs and symptoms. Be aware of how everyday language can affect responses. So sometimes some terms might affect the person in a different way. Ask the patient to teach you the information you have told them to ensure that they understood. So this is something that I also discussed in my previous slide, that always ask how much the patient has understood of what you have told. So with this, I come to the end of my presentation. I'll be back again with the second part of my presentation. Don't forget to like and subscribe our YouTube channel. Don't forget to follow us on Facebook page. And if you have any queries, any questions, any feedback regarding this presentation, drop them in on our Facebook page, or you can also email us on our Gmail ID. All of these informations are available on our Facebook page. So till then, take care. Allah Hafiz.